So somebody wanted to know about anion gap in neuro-ophthalmology, and that's a very unusual intersection of two things. One's a laboratory finding and one's a clinical presentation. And so the anion gap is the gap in the anions and the cations. And so the sodium minus the bicarb and the chloride, which are the negative, and sodium is the predominant positive, although there is some potassium in there. But in general, this is how the machine is going to measure this anion gap. And so that gap has got to be filled by something else in your blood that's causing it. And so in medical school, you probably learned some mnemonic to explain how you could have this anion gap. And I'll just show you the ones that come to me. So methanol and ethylene glycol appear to me in the same way, which is bilateral, simultaneous central loss of vision. It's often severe, like no light perception or light perception vision. It's bilateral, simultaneous. The disc is usually swollen and pale, and eventually it's going to become pale. The imaging study, of course, is normal. And both methanol and ethylene glycol are metabolized in the same way as ethanol through alcohol dehydrogenase and aldehyde dehydrogenase, but the downstream products of methanol are toxic, and same with ethylene glycol. So in methanol, the alcohol dehydrogenase converts it to the formaldehyde, the aldehyde, and formaldehyde is already toxic, and then it's continued with the aldehyde dehydrogenase to an even more toxic substance called formic acid, which is like fire ants blinding you. In ethylene glycol, the same pathway except different intermediate products, including oxalate, which is going to be very nephrotoxic. And so these patients should have dialysis considerations, and we have a medicine that can block the development of the downstream products, which is fomepizole. In worst case scenarios, we can give ethanol, which would be a competitive agonist to suck up all the ADH, but that's going to make you intoxicated. So preferentially, we're going to give fomepizole and consider dialysis for both of these anion gap related bilateral simultaneous acute optic neuropathies. In uremic optic neuropathy, they obviously have kidney disease. That uremic optic neuropathy sometimes requires dialysis, and the dialysis can cause fluctuations in the blood pressure leading to ischemic optic neuropathy. And the D is DKA, diabetic ketoacidosis, and that comes to me as an acute ophthalmoplegia or an acute optic neuropathy in a patient who has diabetes and DKA, and that's usually from underlying mucormycosis in the orbital apex. The P ones are those drugs which don't actually come to me. And INH, that one can come to me because they were already on ethambutol for TB. They stopped the ethambutol because of bilateral central vision loss, again, the same as methanol and ethylene glycol, except way slower. And if they're still losing the vision despite ethambutol being discontinued, we could stop the INH. Lactic acidosis is a very non-specific thing that happens after a whole bunch of metabolic derangements where you're shifting your ATP production to the anaerobic pathway. And you need to know that there are some things that cause lactic acidosis as a predominant part of the condition. And one of those is a mitochondrial disorder, which is lactic acidosis with stroke-like episodes in the setting of myoclonic epilepsy, MRF, and mitochondrial encephalopathy. These are associated with lactic acidosis, but all the mitochondrial disorders, because they are affecting the Krebs cycle and mitochondrial production of ATP, can cause lactic acidosis. There are a whole bunch of other metabolic derangement that shift to lactic acidosis, and the aspirin, the salicylate doesn't actually come to me. So when you're dealing with an anion gap acidosis, the main things are, is it acute and sudden? Are you dealing with a toxicity? Methylene glycol, methanol, is it a slower one like INH? Are you dealing with kidney failure, uremic optic neuropathy, or diabetic or lactic acidosis? And those are the things you need to know in neuro-op about the anion gap.